So how does isolation or loneliness affect our health? Well, loneliness can increase the risk of early mortality by 26%. And this is comparable to the impact of well-known risk factors such as obesity and smoking. And arguably these are a lot more talked about. It is associated with an acute stress response which drives inflammation and the etiology of chronic disease. So why is this? Well, when we feel lonely or isolated, we reach out to people close to us. If this isn't achieved or we don't feel safe or secure, the brain reacts as though something is wrong. We go into a fight or kind of danger mode, and this puts us into that damaging, low-level chronic stress state. And it's this common pathway of inflammation that affects our health longer term. Loneliness is associated with a 29% increase in the risk of coronary artery disease and a 30% increase of stroke. We know it's associated with poorer sleep quality, and this can then in turn impact the immune system. It's considered a risk factor for type 2 diabetes, and actually a study has found a twofold increase in those people that are found to be lonely. Social isolation and loneliness are risk factors for the progression of frailty, and I think we'll see that in a lot of our patients. And a study on Parkinson's disease showed that people who felt lonely experienced a 55% greater symptom severity than those who weren't. And something that I found quite interesting in a lot of the research showed that social isolation affects the same centres of our brain that are activated by physical pain. So loneliness can cause or certainly exacerbate chronic pain. And I think that's something we should always be considering when perhaps seeing patients that have long-term pain problems. So it clearly is affecting our health, and perhaps part of this is how it affects our behaviour. For example, if you're lonely, you're far more likely to smoke, eat unhealthily, and perhaps not adhere to your medications. And I think one of the biggest negative health outcomes of being lonely is the experience of depression, 60% of these people. And it is actually one of the highest predictors of suicide in older adults. And if we look at the bigger impact on the NHS, older people living alone are 50% more likely to access emergency services and 40% more likely to have more than 12 GP appointments a year. So as you can see, it is so important that this is something we are considering.